Coming up on Talk of the Town, let's talk about our health. The buzzword I keep hearing about is functional medicine. What is it, and why is this approach something that everyone is talking about? And let's take a trip to the grocery store without spending a fortune. Everything feels so expensive these days. Our expert is local functional medicine coach Krisler Bailey. She is the owner of Health Coaching with Krisler. This episode's brought to you by Real News PR and Real News Communications Network, video podcasting and public relations at the speed of news. Hello and welcome to Talk of the Town. I'm Sarah Crilley, and today we're talking all about eating healthy on a budget. What is functional medicine and more? I have with me in studio Coach Krisler. Hello. She's our expert in functional medicine, all things health, all the things that I personally need to learn about. Hello and welcome, Coach Krisler.
Hey, Sarah. I'm so excited to be here with you. Thank you for having me.
Yes, ma'am. I mean, the tables are kind of turned because you're typically the podcast host here. So here I get to interview you, and I hear it's been a little bit since you've been interviewed. So thank you for the honor and privilege to interview you today.
Thank you. Yeah. So earlier at the beginning of the year, I had a guest flip the script on me, and she came back and she interviewed me on my podcast. It was really, really fun. So I'm glad to be back in the hot seat again.
Yes, the hot seat. And of course, we have none other than Chris Campari. He is going to be my co-host today because
Hello.
We are very passionate about eating healthy and working out and doing all the things, but it's a little challenging, isn't it, Chris? I mean, what are some of the tips and tricks you have for the diet changes and eating healthy on a budget? It's kind of expensive, isn't it?
Oh my goodness. Very difficult for me. I'm the worst cook in the world, but no, I go to gym probably like 3 times a week. Actually, the gym that where our other office is in North Dallas. So very lucky to have that gym a part of our workspace. And as far as food goes, I just pretty simple: chicken rice, white rice every day. I do oatmeal in the morning, but I need to eat more. I'm trying to bulk and pack on muscle right now, so I need to eat probably. I'll end with this: I need to eat probably 1 gram of protein per body weight. That's probably what I'm striving for right now. But everyone's different. Everyone's body's different.
Well, speaking of being so different, I am not measuring my caloric intake and all of the things, but I do know that I need to eat healthy. My doctor tells me that I have high cholesterol at 33. This girl. I'm like, what? And I'll admit, I mean, I have felt a little off. You know, I had my baby, and so I'm, sleeping haphazardly, and just my, coming into the studio and being present and interviews takes a lot out of me. So the routine of finding time to eat and not going through the drive-through. I mean, yesterday, my son and I picked up my son from school. He's starving because he skipped lunch because he didn't like what they had through the lunch line. Mommy's hungry. Can we go to Subway, Mom? And I was like, yes, fine. But Subway, I find out, is like the worst. Like the bread is all sugar. Oh my gosh. So this is going to terrify you with everything that Coach Krisler is going to share. However, she's got your back. She's the expert here. So let's start with functional medicine, because we got the problem, right? Americans, the world, we're just not as healthy as we should be. I mean, it's easy to go through the fast food line. But what do we make on that grocery list? What is functional medicine? I know I'm throwing a lot at you, but when we come back, Coach Krisler is going to share all of that and more. And we're back. I know everybody's dying to hear, what is functional medicine?
So functional medicine is actually an approach to healthcare that medical professionals take to get to the root cause of whatever your ailment is. So if a person has diabetes, if they have high cholesterol, hypertension, they have cancer, whatever the issue is, functional medicines are the bloodhounds of the healthcare system. They work to find out what the root cause of that issue is. And that's what they go after, and that's what they address.
I love that. I'll share with you, my doctor, we were going through, my high cholesterol. He was like, I'm happy that, because we did this whole 360 scan thing, right? Thank you, Dr. James. We found out that I'm no longer pre-diabetic. Okay, this is good. At 23, I found out I was 43 on the inside.
Mm-hmm.
And I was like, Dr. James, how? And he's like, what's your diet? I said, caffeine and carbohydrates. He's like, what about like the fruits and the veggies? All the okay, so now I'm eating the fruits and the veggies. It's been about 10 years. We did the 360 again. And he's like, wow, you're not pre-diabetic. Good for you. You have high cholesterol, though. I don't know. You're a little young, and he's kind of going through it. There's certain things that could be triggering the high cholesterol. What is your approach when it comes to somebody like me that has high cholesterol?
My approach, honestly, is the same with anyone who comes to me with an ailment. First, I ask them a lot of questions about their habits, because as a health coach, I really want to know what you are doing on a daily basis. And my commitment to you is not to judge you for that. Because honestly, 2 weeks ago, I was face deep in a box of donuts. I had 3 in a row, and my body was telling me the next day that wasn't a good idea. So you know what? We just roll with it. There's no judgment here.
Thank you. That is such a gift because I have so much mom guilt and all the things, right? But you're my best friend for saying that.
Honestly, that's a big deal. That's a reason why a lot of people don't seek out help is because they're afraid they're going to be judged.
Yes. And they're not going to be completely honest.
Right. So I really try to set up a safe space for my coaching clients when they come. I want them to be open and honest with me. Tell me what you're doing. Tell me what you're not doing. Tell me how you're feeling. That's a big one. I want to know how you feel day to day when you're eating certain things or exercising or what have you. And then we talk about the goal. If the goal is, lowering your cholesterol, then we talk about how do you get there through a variety of lifestyle things. A lot of things are connected. Your whole body is connected. So it isn't necessarily going to be one thing that's the pill that fixes everything.
Right.
It's going to be your nutrition. It's going to be your sleep. It's going to be your exercise habits. It's going to be how you even think about what you're doing or how your day is going, right? Your thoughts are connected to what's going on physically in your body. So we're going to look at all the things.
That's so important, Coach Krisler. How did you get started in functional medicine?
When I first started college, I actually started out to be a doctor. I was going to be a pediatrician. So I started in biochemistry and I was doing all the things. And then I took organic chemistry and I was like, no, thank you. I'm done with this. So I changed my major to sociology, added a minor, community health. And at that point, I was feeling like there had to be a way to help people in health, but I didn't really know what that would look like. Fast forward after 20 years of being a professor and all of that, becoming a working mom, just life took me down this road. I started realizing that I wasn't the best that I could be. And I started taking supplements. That's where I started personally. And I started thinking, wow, these are actually working. Like my doctor had been telling me, oh, you need to take a multivitamin. You're coming towards 40. Like you need to start doing these things. And I was like, okay, yeah, whatever. But I started taking certain supplements. Was like, okay, something's changing. Why? And so I started digging. Why do supplements help? Why do we need supplements? And I started asking questions, following doctors that were talking about these specific things. And that's how I really landed into functional medicine.
Wow.
And there's one particular doctor that I just really connected with from Arkansas. Her name is Dr. Amy Beard. Started following her. And at this time, I had also left my full-time job. So I was trying to figure out what I was going to do. If I was going to stay in higher education, if I was going to move on to something else. And I heard Dr. Beard talk about having health coaches in her functional medicine practice. And I was like, this sounds interesting. And the more I asked, the more I followed, the more I dug, I was like, this is the thing. This is what I'm supposed to do now. And that's really kind of how my direction went towards functional medicine. So I knew I wanted to be trained. I knew I didn't want to be just one of those health coaches out there that says, this is what I am, pay me money. I wanted to be the one that was trained. I wanted to have tons of resources in my back pocket to hand to clients and say, this is for you. I wanted to be the one that people could trust. So I looked into some programs and found a phenomenal program through the Functional Medicine Coaching Academy. They are in partnership with the Institute for Functional Medicine. So my school trains lay people basically, and sometimes licensed practitioners as well to be coaches specifically. And the Institute for Functional Medicine trains medical professionals, doctors, DOs, chiropractors, nurses, all of that. So those two schools have a partnership. And that's what I was like, yes, I want to go to a school that's accredited, that has, the people that really know what they're talking about, right? That have been in this, that have researched. So that's how I got trained, and that's where I started.
That's amazing, Coach Krisler. Thank you for sharing that with me. I'm always curious, like, what makes people tick? How do they find their thing? And you found your thing, and you're saving lives day in and day out and making people's lives better. What does that look like? So share with me some of those success stories.
I'm currently coaching a physician assistant. One of my clients is a physician assistant. She works actually in a traditional medical practice, but her values very much align with functional medicine. She's going through training through IFM as well right now. So I get to coach her. She's somebody who has struggled a long time with joint issues and pain. She's had a lot of different struggles and different diagnoses. And so what she came to me for was to help her through the elimination reintroduction process. So basically what that means is she eliminated a bunch of inflammatory foods and is slowly now reintroducing them into her diet to see if she has any sort of food sensitivity. Since she has gone through that process, her pain has all but gone away. She has recognized some really interesting things about her eating habits and what she really needs to do in order to plan, and things that she needs to cook or she needs to cut out and keep out of her diet. Her skin is clearing up. There's just so many really cool things that are happening. And this is somebody who's been a medical professional for multiple decades, and she is going through this process.
Wow. Oh my gosh. So share with me, Coach Krisler, what's going on with our food? You mentioned food, and that's a big key to health and longevity, is our dining decisions, but also what we're choosing to snack on. It's those big meals, it's the small meals. Everybody's different. You talked about inflammatory foods. Where do we even start?
Oh my gosh.
Food.
I know. There's so many things.
It makes it hard.
Yes. And I love food too. I mean, I like to sit down at a good meal. I like to be around friends and just make it a big social event. Food is so fun. But it's information. It's information for your body. It is fuel for your body. But also, people need to recognize, and this goes back to the no judgment thing, food can be comfort. It can be memories, right? When you think about some of the really sweet things you did with your grandma, like making cookies, or it's like, why do you love this pie? It may not just be the pie. I mean, it's delicious, right? But it's that time you got to spend in the kitchen with your grandma. There's sweet memories attached to it. So again, when I work with a client, we don't look at just the food itself. We look at all the things that are surrounding the food. So it may not even just be the sugar that's, inciting the negative thing that's going on in their body, but it could be that memory that they're missing, right? They lost their grandma. It's a traumatic event. Now it's sparking something in them that's having that negative effect. So we really look at all the things surrounding what we're eating, how we're eating, right? Are you standing up on the go? Are you sitting in your car? Are you driving through, right? All the different things are so important when we look at something like food.
Wow, that's so important to have the customized approach to everyone's lifestyle. And then the memories. I mean, I'll say my mom loves baking, loves it. I love her baking. I love the smells. But I know I've got high cholesterol. I can't be eating that all the time. And she loves to make cookies all the time. And it's grown past the holidays. So would you suggest, even in our situation, we're baking something healthier, or what do you suggest for the family that just loves the smells and the memories? And are you swapping out
Yeah, absolutely.
ingredients, or
I love doing a swap because let me just tell you right now, I'm not giving up cookies. They are not going away from my life. So I do a healthy swap. Instead of using regular sugar, I'll use coconut sugar. Or maybe you might use maple syrup, right? Organic maple syrup or honey in order to sweeten something. You can even just cut back. If you're using sugar, cut it to half. So you're not putting 2 cups of sugar, right? You're just putting the 1 cup. And I understand that, things may change in terms of the taste. It's not going to taste exactly the same if you cut back on that sugar. However, you're retraining your body through that process to not have those glucose spikes that then brings on the insulin, that can bring on the insulin resistance, that then brings on the joint pain and the headaches and all the other things. So I love a healthy swap. There's so many things you can do. I mean, just get on Pinterest and spend 2 hours scrolling and finding, different recipes. One of the really cool resources that I use and I share with people all the time is a website. And this lady also has an Instagram as well, but she's the Detoxinista. And her name is Megan. She has some great recipes and she does the swaps. She doesn't use sugar. She has a lot of recipes that really are delicious, right? But they're not as damaging to your body.
wow, I love that. The
Detoxinista.
Detoxinista. That's so sweet. I love that for branding too. Detoxinista. Do we need to detox our bodies with all this stuff? How do I just need to work out more often? I mean, what's your philosophy when it comes to coming to see you? Should I kind of prep my body or come right as I am?
You can come right as you are. So detox is one of those words that is like a big buzzword. Everybody's doing a detox or juicing, whatever they're doing. However, in many cases, I would say most cases, you probably don't need to go through all of that, right? Starving yourself or putting your body in the throes of some sort of detox because your body already has a natural detox process.
Really?
Absolutely. Like the way your body functions in a healthy state, it is pulling out those unhealthy, all the dead cells in your body or, all the extra salts, right? Your body already knows how to process and eliminate those things. What we do is we create a way for you to eat as healthy as possible so your body uses all of the good nutrients, gets rid of all the crap, in some cases, literally, right? So in order to detox, you need to be sweating regularly, right? Daily, I would say, get on a good sweat. You need to be urinating all day long. Well, not all day long, but
Enough.
you need
once
to be
a
going
day because I'm drinking my coffee. Is that really dehydrating me?
Yeah, I would have to say, if you're drinking multiple cups of coffee a day, that definitely could be a concern.
Yeah, girl, we're gonna
right?
have to talk.
We need to swap it out for some water.
Do I have a problem? I don't like water. I said it. I know.
You know what?
And I don't want to put all that crap in it. I don't want to put the squeezy things, to flavor it. I don't need that. I just need to drink it. I just need to get over it.
Yeah. So
maybe cucumber.
So here's the thing. You don't have to love plain water. You can add lemon to your water. just, a slice of lemon, squeeze it in there, throw it in there, and now you've got a little flavored water, and you're also getting the goodness from the lemon or lime. You can do sparkling water as long as it's unsweetened. You can also do electrolytes as well. And basically that's just like salt and minerals, right? The good stuff. So if you are doing plain water, you might honestly just be flushing. You also want to do electrolytes as well to hydrate, right? Because the salt actually helps you to hold on to what you need. You obviously need minerals, right, in your body. You need potassium. You need all these good things. So it's okay to have some of the powdered electrolytes or squeezy things as long as it's just the minerals, right? Once you start throwing in sugar or artificial sweeteners or quote unquote natural flavors, right? That's when you get into trouble with those extra things.
Natural flavors sounds so healthy, doesn't it? That's marketing. It's not supposed to be. Anyways, let's talk a little bit about the moment we've all been waiting for. Okay, we need to eat healthier. How do we eat healthier on a budget?
Okay.
It's expensive. Everything's expensive. Inflation. Eggs are like $6 or $8. I don't even know. I don't even look anymore. I'm like, all right, I need the eggs and I'm going to cut out other stuff. But how do we eat healthy on a budget?
First of all, you have to have a budget.
Okay.
That is where people, I think, miss the big ship, right? It has sailed. If you don't even have a budget to start with,
yes,
you are not doing yourself a service at all. So start with a budget. Decide how much you are going to spend weekly on food. And that could be groceries and eating out together, or you could put it in a separate line in your budget. But you need to know how much money you have to spend so that you control that and your money is not controlling you, right? If you go into the grocery store with no plan, you leave and you're like, how did I spend $350 and I came in here for milk and bread?
I feel like I got 10 things for $350, right? It's crazy. Mm-hmm. It's crazy.
Yeah.
I don't even know what I'm buying. I'm buying some of this. I mean, you blink and you're like, wait a second, what was so expensive?
Yeah.
All of it's more expensive. So how do you budget, and what does your lifestyle look like when you're feeding your family?
So like I said, I have not worked full time since 2017. So it's been some time. And since that time, we moved into our home that we absolutely love. And so, we have 2 growing boys who are starting to eat more and more and more.
Shout out to the ages. How old are they?
They are 11 and 8.
Yes.
Whew, and that 11-year-old, Lord have mercy, pray for me.
And
then, I'm married too. So there's 4 people in my home. My grocery budget is very meager. If I said the number, people would probably pass out, and I am going to say the number. We budget for $125 a week in groceries.
How?
Planning. So I also shop at places like Aldi and Winco. Those are my 2 top stores that I shop at. I also will shop at Walmart because I love pickup.
Yes.
So, but I don't go to any other stores for my groceries because that would take it outside of the range of what we budget for food. So that's what I do. And I plan my week. I actually have a chalkboard in my kitchen where it was just an empty wall that wasn't doing anything. So I was like, turn it into a chalkboard wall. I got sick of my kids asking me what's for dinner every night. So I write it down every week on the chalkboard wall. They can see. So the first thing I do is I go into my pantry and my refrigerator and I see, what do I have? What do I already have that can be a part of this week's dinners? Okay. The second thing I do is I make a list of what I'm going to make for the week. So if I've got a whole chicken already, then that goes on the board. I make a roast chicken and then I pick some vegetables to go with that. And then I say, okay, the next day we're going to have tacos. The next day we're going to have, chicken sandwiches and whatever it is, right? And I always have the meat and the sides because we are meat eaters. And so I make that plan for the week. And I do cook at home 6 days a week, or we eat at home 6 days a week. Sometimes it's leftovers, but we eat at home 6, sometimes 7 days a week. So that is a big part of what we plan and what we budget for. So that's where I start.
What are some of those family favorites? What are you cooking? What are we making tonight?
So tonight, what is today? Oh my gosh.
Tuesday already.
Today
actually.
is Tuesday. It's Taco Tuesday.
Hey,
so
Taco Tuesday. That's cute. So you
Yeah.
kind of have these fun little weekly routines. Okay.
Yep.
Take some of the guesswork out of it.
Exactly. So I found these little like boats. We call them taco boats. It makes it a little less messy for tacos because I have kids and they're a hot mess. So we use taco boats, and my kids are pretty simple. They're just meat and cheese. So, okay. My husband and I like salsa. I make my own salsa.
You make your own salsa.
Yeah, girl, you just throw the things in the blender and blend it up. It is easy. It takes 5 minutes.
Tomatoes, onion.
I do tomatoes, onions, garlic, cilantro, and a lot of times I'll put jalapeno juice in because I like that flavor. And my family doesn't really do spicy. So
And that's all the vegetables.
and
Now you're healthy.
and that's all the
Now you get the vegetables in there.
So how do you get kids to eat fruits and vegetables?
Make homemade salsa.
Give them salsa.
Oh my
Right?
gosh.
And I make it homemade because the jarred salsa has extra things in it that I don't want to give my kids. They already eat enough crap as it is.
Yes.
If I can pull back somewhere on those things, it's a win for me.
This is a win for me right now. This is what we're doing tonight.
Yeah. So
Taco Tuesday with the homemade salsa. Okay, any tips on what are the best tomatoes that are sweeter or whatever? Do you kind of have your favorites or whatever's on sale?
girl,
Girl.
I get the canned tomatoes.
You get the canned tomatoes.
I do. I do canned tomatoes with no salt added.
Yep.
And you can get organic canned tomatoes. So I do that, and I usually do like 1 can of regular just diced tomatoes, and then the other can I do is the tomatoes with the chilies. And
What
I
was
do
that? I'm hearing a cooking show is coming with Coach Krisler and Sarah. Do you think we could do a cooking show together? That'd be kind of fun.
No, it might be a little messy.
No, you're really inspiring me. Truly. Keep going. Sorry.
Yeah, so I do 1 can of regular tomatoes, 1 can with chilies in it, the mild, for my family because they don't like spicy. Throw it in there, blend it all up, and I save jars from like the mayonnaise or whatever. I just save the mayonnaise jars. It goes in a save jar. I have a little thing, a little sticker that I've gotten from, Walmart, whatever. Put a little sticker on the jar. Salsa, boom, it goes in the refrigerator. And I usually make enough to do 2 jars because my older son is a chips and salsa-aholic. So he likes that as an afternoon snack after school. So he goes through lots of salsa.
I love this. I'm thinking eggs the next day with some, potato, add the salsa on top, right?
Yep.
You can maximize the salsa,
Yep.
other things.
And when you cook, you can make more than what you need. So now you have leftovers for lunches the next day. So this is another way that we keep our food budget low and we don't eat out is I make extras. So last night I made a roast chicken and my kids always get the drumsticks. My husband likes the breast part of the chicken. I eat whatever, right? But we have leftover chicken. So what do I do sometimes with the leftover chicken? I shred it up and I make quesadillas on the second day.
There you go.
So now I have 2 meals from 1 full chicken. And then I save the bones and I make my own broth.
Okay, let's talk about the bone broth.
Yeah, stupid easy. I don't know why I avoided this Like my whole life, I was always like, this can be so hard. Literally, you take the bones, you put them in. And I honestly, like everything that I cook my roast chicken with, I just freeze it with my bones. So I just dump it back into the pot, cover it with water, bring it to a boil, and then I let it simmer for a couple of days on the stove. It makes a nice dark broth that's delicious. Either I will just drink a cup of broth, or, on days when it's chilly, I'll make soup. So that leftover chicken that I might have had from the day before, I use it for the soup, and I have the bones from the broth. So again, it's multiple meals you're getting out of that one whole chicken.
Gosh, you're so brilliant. No wonder you're in this industry of saving all of our bodies in a functional medicine way. Tell me about the bone broth. Why bone broth? What is the secret to this bone broth?
So bone broth gives you some good protein. It gives you collagen that, unfortunately we stopped making collagen probably way earlier than people realize. We're in our 20s when that stops happening. So if you want to help your body, like your body needs collagen to continue to make that. So you need to be ingesting it. And that's a great way to do it. You don't necessarily, you can do the powders. I take a collagen supplement because I don't drink bone broth every day, right? So I do supplement, but it's a great way to get healthy in you. And it can be an anti-inflammatory, it can be, there's a reason why when you were a little kid, your mom gave you soup, right? Now, I won't name any companies, but that really popular soup that your mom probably brought you.
The one with the red can?
Mm-hmm. They, it's not probably the healthiest, but you can easily make your own broth. And it could be something that gives you some nourishment when you're not feeling well, right? To keep you hydrated and so forth. But also, it's also just good feeling food. It's like when it's warm and, you kind of got that warm mug in your hand and it's cold outside, like just going back to that comfort. It's like, it's nice and comforting. It tastes good. Yeah.
Coach Krisler, you're my comfort right now. You make this sound so easy, but we all know it's not. So you guys got to give her a call. She is the expert. She's your best friend. She got your back. How do we get a hold of you and keep up with you? You have your show, so we can follow you on your show, of course. You're interviewing experts in the field and getting the awareness out there about, our health, mind, body, spirit, all of the things.
Yeah. So I am on YouTube. You can find me at Health Coaching with Krisler. It's been so fun because I have interviewed over 30 people so far who have used functional medicine in their health journey. Dr. Beard, I mentioned her earlier. She actually was one of my earlier guests. She has a really interesting story about, how she was as a young person and just, all the things she dealt with. But she actually had part of her colon removed. She had 18 inches removed.
Wow.
And so you're like, what do you have left? No wonder you're so tiny because there's nothing left. But she had so much going on. And even since then, she's a healthy person. And she used functional medicine principles to heal herself. And now, of course, does that with her patients. But I have had people who have fought cancer on my show. I've had a celebrity chef who talks very personally about, being a young man and just dealing with certain things surrounding himself and his body and different things. I've had Jen Stevens on. She talks about intermittent fasting and just how being a teacher was really a struggle for her with food and just different things, that environment, stressful, all that. And now she has lost a ton of weight, but even it's just not about the weight for her, just how her lifestyle has changed, and it's changed for the better. And there's just I could go on and on and on about the people I've talked to.
And you love it.
I do. It's
You're
so fun.
lighting up right now. You're so excited.
It's so fun.
I
Yeah.
feel the energy. And I've watched your show, and you are a very talented host.
Oh, thank you.
You know the right questions to ask and put everybody at ease. So that's a gift. That's a gift to be able to do that and help others tell their story.
Yeah, you know what? I think it's a big part of it has been my experience in the different jobs that I've had over my lifetime, culminating with this training that I've had with coaching. The Functional Medicine Coaching Academy really wants their graduates to know what coaching is, to know how to do it appropriately, to make sure the clients stay at the center of coaching. And so we learn how to ask questions, how to ask meaningful questions, how to really pull that self-discovery out of people. And so I think that's a big part of what's really helped me to do this, is because that training is really client-centered, and it really is focused on getting that information out of people in a helpful, non-judgmental way.
That's so fantastic. So you're telling me you're a natural and you've been trained.
There you go.
But what can't be trained is your energy. You are just so amazing and passionate, and you're doing exactly what you need to be doing. So thank you for being a gift to our world and making us healthier.
Thank you.
Can't
Appreciate
wait to
it.
have you back. We got to be doing some kind of a cooking channel at some point.
Yeah, there you go.
All right, guys. Thank you so much for tuning in to Talk of the Town. This is Sarah Crilley. We'll see you guys next time.
This show is brought to you by Real News Communications Network, your digital destination for video podcasts, produced by media and podcast experts. Podcasting at the speed of news, powered by Real News PR. Visit realnewscn.com for our podcast show library and launchashow.com to do just that, launch a show.